Patients I would test are patients who need to be on aspirin therapy, and ideally you want to be on the lowest dose of aspirin that's effective. If 81 milligrams works, that's the dose you want to be on. If it doesn't work and you may need a higher dose, we need to find that out. Patients who should be on aspirin therapy are patients who are identified as having a significant risk of coronary disease or stroke in the future. Patients who are at 10% risk or greater of having a heart attack in the next 10 years should be on aspirin therapy. I use the lowest dose. The lowest dose that works. That's the dose you should use. The effect of aspirin is to prevent part of the process by which platelets clump together and form clots in arteries. Clots in arteries are mostly formed by platelets. Preventing clots is the mainstay of therapy in preventing heart attacks and strokes in patients who are at risk for heart attacks and strokes. Patients who should be taking aspirin are patients who are at risk of coronary disease. Generally, the American Heart Association and the American College of Cardiology has defined significant enough risk to require aspirin therapy in any patient who has a 10-year, 10% risk of having a heart attack or stroke. If you can use the lowest effective dose of aspirin, you can minimize the risk of bleeding. The lowest effective dose is the dose that achieves the chemical effect that aspirin is supposed to do, and that is block thromboxane.